Today I'll be talking about biomechanics and functional anatomy of the hip. The hip is the largest ball and socket joint in the body. It differs in design from the more common hinge joints in order to meet the requirements of ambulation. In addition to its stability, the hip joint is also a very mobile joint, second only to the shoulder joint in the body. The hip joint has 3 degrees of freedom. That is, it moves in 3 different planes: sagittal plane flexion, extension, frontal plane abduction, adduction, and transverse plane external, internal rotation. In the sagittal plane, the hip flexes to 120 degrees and extends to 20 degrees. In the frontal plane, the hip abducts 45 to 50 degrees and adducts 20 to 30 degrees. In the transverse plane, the hip externally or laterally rotates 45 degrees and internally or medially rotates to 35 degrees. During gait, the hip moves a total of 40 degrees in the sagittal plane, 11 degrees in the frontal plane, and 8 degrees in the transverse plane. Ground reaction forces are also a factor for hip biomechanics during gait. As the body advances from heel strike to toe off, the ground reaction force vector changes from anterior to the hip joint to posterior.